and welcome to NAFDAC and Your Health. Every week on the program, we provide you with insightful information about NAFDAC's activities aimed at protecting the health of Nigerians. I am your host, Tosin Adebayo. This week on the program, we will start by highlighting the Human Capacity Development Training for the Assistant Directors of the National Agency for Food and Drug Administration and Control, NAFDAC. Deputy directors in the agency had earlier undergone same training, and now is the turn of the assistant directors. The 3-day executive training on anti-corruption, leadership in the 21st century, and ethical value in the workplace is the continuous re-engineering of the regulatory agency for qualitative service delivery. To set the ball rolling, the trainer prepared the trainees for the task ahead with a pre-test. The exercise was also interactive, as the trainer, who is a civil service retiree with an international exposure, takes the participants through a module on leadership. Corruption as a societal ill was also discussed at the training, and its effect on the public service is highlighted, while property and accountability as an antidote to corruption in the public service was preferred. The participants were charged to put corporate interest ahead of self-interest when discharging their duties in the agency.
This is very important. The corporate interest should be above an individual interest, meaning the organizational interest is far more than an individual's interest. We should always have that in mind.
The training was rounded off with participants sharing their takeaways from the exercise. From there, we moved to the first interactive meeting the Acting Director General of NAFDAC had with the management team of the agency. Dr. Monica Emunjeze, who, until her appointment, was the Director of Drug Regulation and Regulatory Affairs, challenges the management to uphold the organization's vision by working collectively to achieve the desired goal.
What Professor Adeyeye has done in NAFDAC is definitely something nobody can dispute. She has been able to raise the bar. She has been able to raise the bar and is globally recognized. There is no one that can take that away. I really wish she was standing here so we could really give her a round of applause and celebrate her for that. I personally have learned a lot from her, and I know many of you can also say the same. So I think with that, we owe her a responsibility, no matter the condition we find ourselves in, to make sure that we have actually learned something and that the structures that have been built are actually structures. Because this is going to test whether this QMS we talk about is really entrenched in this system. Because we're building a system, we're not building something that is individual, that should change. That's the whole point of a quality management structure that is entrenched and embedded. It should be sustained, it should be continuous, irrespective of what happens. That is the true test. Are we totally there? No. But we're well on our way to where we need to be. But then again, we are ISO 9001 certified.
As the National Agency for Food and Drug Administration and Control transit from one leadership to the other, the Acting Director General is eager to follow up on the agency's work on the World Health Organization benchmark, vaccine production, and traceability.
It is very critical that we sustain the efforts that have been on ground and continue in the right direction to move many of these projects forward. As you well know, WHO Maturity Level 3 is the designation for NAFDAC. We will definitely work to consolidate that and move the agency forward. The issue of vaccine manufacturing is very key, as well as the local manufacture of pharmaceutical products. As you well know, we have the largest base of manufacturers within the sub-region, and we will work with our stakeholders to consolidate that and make sure that we have a regulatory framework in place that allows us to effectively regulate manufacturers of vaccines, which are a little bit more than the other products, where you need some added expertise and all of that. So we're working to ensure that we have the capacity to do that, and we'll be able to support industry in that regard and provide the necessary regulatory guidance to ensure that we realize the vision and the aspiration to, again, manufacture vaccines in Nigeria, because that has been done before. So it's definitely something that we can do, and we will work with our stakeholders, supporting the efforts to make sure that we realize that vision. In other areas as well, traceability is something that we have keyed into. We were working from the beginning with our stakeholders to develop a traceability plan for Nigeria, which was endorsed by the Honorable Minister of Health, Dr. Hanire, and there is a plan in place. We co-chair that steering committee for traceability, and so we'll continue to work with that to ensure that the gains we have made are consolidated. We've been able to demonstrate that traceability can work. We deployed those with the COVID-19 vaccines, and we're able to have a proof of concept to show that this is something that is actually achievable. So we'll continue to work the plan, and that will allow us to secure our supply chain for pharmaceuticals and assure Nigerians of the quality of products that are within circulation.
She is also looking at improving the relationship between the agency and all stakeholders in order to sanitize the sector and create an enabling environment.
A lot of the time, what we have realized is there is a gap between the regulated and the regulator. We will work to engage with stakeholders to bring regulation to the community and to grow their understanding of what the requirements are. We will handhold and take stakeholders through the processes, because the desire is to assure the quality of the products. We are very, very supportive of the MSME space and the realization that to diversify the economy, we need to build entrepreneurs. But building entrepreneurs, we need to make sure that the products are actually competitive and are of good quality and are able to compete favorably within the space. So we will work to help build capacity of stakeholders in the different sectors where they operate and ensure that they have a better understanding of our processes and actually guide them through the process. We have worked very closely with the initiatives of government and the enabling business environment to ensure that entrepreneurs are carried along, and we'll continue in that effort to drive better understanding of regulation and ensure that the business community has a good understanding of what their expectations are and they are better able to meet the requirements for licensure.
We'll take a short break now. Stay with us.
The MedSafety app is the latest reporting tool introduced by the National Agency for Food, Drug Administration and Control in November 2020 as part of the Innovative Medicines Initiative project. The app is made available to the public in collaboration with World Health Organization, Uppsala Monitoring Center, Medicines and Healthcare Products Regulatory Agency, UK, and National Agency for Food, Drugs and Administration and Control, NAFDAC. The MedSafety app allows users to track safety information of medicines, vaccines and other health products, report adverse drug reaction to a medicine or vaccine, and view data on suspected side effects. When you have received your COVID-19 vaccine, you can use the MedSafety app to report any adverse reaction or side effect you may feel. The app can be used by anybody, irrespective of whether you are a medical practitioner or not. You, your family and friends, everyone can download and use the MedSafety app to report adverse drug reaction. Just search for MedSafety on Google Play Store for Android and App Store for iOS. When using the app for the first time, the user needs to select his or her region. In this case, Nigeria, and also choose the preferred language of choice. The user will then be taken to the login page where you create an account by providing your email and password, or proceed as a guest. To create an account, you are required to provide the following details: reporter type, example, physician or pharmacist, as well as their name and email address, password with at least 9 characters with 1 uppercase letter and a number. Read the privacy statement and accept. Once you are logged in, the user is presented with a number of tabs, which includes news, products and watch lists. Under the Report tab, the user can report a new suspected adverse drug reaction ADR. On opening a new report, the user is prompted to input patient details, which include initials, sex, and date of birth. The user is then required to input details of the suspected medicine. These include suspected medicine name, other drug details such as strength, batch, dosage details. Multiple suspect drugs and concomitant drugs can be added at any time. The report can be saved and completed at a later time. A saved report can be found on Pending Reports and can be continued by clicking on the report and continuing from where the user stopped. Enter reaction details, reaction date and outcomes. Multiple suspects' reaction can also be added. Also, further details about the report can also be included, such as did the reaction cause prolonged hospitalization, disability, congenital anomaly, or birth defect, life-threatening results in deaths, and so on. Finally, you can also add details of any relevant medical history before submitting the report. The user receives a message on the app confirming submission and an acknowledgement in the mail for submission. Reports can be created and saved without internet connection and be sent whenever internet connection is available. The product tabs show all medicines in the NAFDAC list database. It's easier to navigate to a drug or vaccine of interest, and this data is obtained from the WHO Uppsala Monitoring Center. User can also add products of interest to their watch list to get the latest information on the drugs. All products added to the watch list can be viewed in the Watch List tab. The News tab displays drug safety information by NAFDAC. This is usually up to date with drug safety information. Registered users can also edit their profile or change app settings. For more information on the app, please contact the National Pharmacovigilance Center (NPC) at NAFDAC Headquarters, Plot 2032, Olusegun Obasanjo Way, Wuse Zone 7, Abuja, or call 09290511110 or send email to medsafetyapp@nafdac.gov.ng or pharmacovigilance@nafdac.gov.ng.
Welcome back. If you are just joining us, you're watching NAFDAC and Your Health. As an agency which is fully committed to projects or events that prioritize the health of Nigerians, we bring the report on the second edition of Vanguard Mental Health Summit. The summit, which focuses on the impact of mental health crisis on the national economy with theme Mental Health in a Distressed Economy and a sub-theme Drug Abuse, a New Force Driving Mental Health Crisis in Nigeria, had stakeholders in attendance. The editor-in-chief, in his opening remarks, gives the reason why Vanguard is leading the campaign through a forum of different stakeholders.
We are gathered here today, second time around, to continue the conversation. This year's campaign focuses on the impact of mental health crisis on the national economy, with the theme Mental Health in a Distressed Economy and sub-theme Drug Abuse, a New Force Driving the Mental Health Crisis in Nigeria. We are taking the discussion to the next level, a nurture. Through the Mental Health Summit series, Vanguard newspaper has given a new orientation and purpose to the discourse by educating and informing the general public to make informed decisions and commentaries on one hand and strengthening the hope and expectations of those directly affected on the other. Our determination is that things must change and change for the better. We are proud advocates of that change through the Vanguard Mental Health Summit series.
President of World Medical Association, Dr. Osahon Enabulele, who is The chairman of the event linked mental health to economic situation and makes an appeal to the president to expedite action on the mental health bill.
Unfortunately, during the COVID-19 pandemic, this burden of mental health affectation is estimated to have increased by about 25%, and we all know the reasons. This was due to a concatenation of factors, including declining economic fortunes and worsening poverty, increased resort to substance use, and the disruption of mental health services, including emergency psychiatric services. Like most low middle income countries, I will not say low middle income countries, the burden of mental health problem in Nigeria is enormous, particularly with the troubling economic downturn, the rising unemployment and poverty, with increasing incidence of substance use by the youths, and the fact that most breadwinners now are unable to meet their family expectations. The burden is made further worse by the brain drain phenomenon, which has led to insufficient numbers, a further depletion of the numbers of mental health professionals, of course, as well as poor awareness, stigmatization, poor budgetary provision for health, and absence of dedicated mental health budgets, weak primary healthcare system, an absence of an effective and efficient referral system, and the absence of modern legislation, in other words, the Mental Health Act, among several other factors. And so, as we seek to advance mental health in Nigeria, I wish to call on our President, the President of the Federal Republic of Nigeria, through this meeting, President Muhammadu Buhari GCFR, to kindly assent to the outstanding mental health bill.
The keynote speaker, a professor of psychiatry, breaks down a distressed economy can cause mental health challenge, the symptoms and remedy.
We have a lot of poor attention to health and education, and these two important areas of economy, they contribute largely to human capital development. And for decades, successive Nigerian governments have not obeyed the United Nations recommendation of minimum budgetary allocation to education and health. And this, in no small way, has been contributing to the economic downturn. Africans, again, we tend to somatize, that is, psychological distress being projected as bodily symptoms. And that is why among Africans, in a state of depression, they can have the following physical complaints like internal heat, complaint of fever, go to the hospital recurrently, and you see our colleagues treating them over and over for typhoid and malaria. And sometimes they go for deliverance from enemies that might have socialized them. All these, most of the time, they are due to anxiety and depression. Then crawling sensation is another physical symptom they can suffer, tension, headache, as well as dizziness. And some physical symptoms that is difficult to interpret to English language. The maintenance of our mental well-being in a distressed economy. This requires a holistic approach. An individual alone cannot do that. It requires a lot of collaboration between the government, non-governmental organizations, and individuals, as well as health institutions, and NGOs. For instance, our own Association of Psychiatrists in Nigeria, have been at the forefront of advocacy for mental health and public enlightenment and educating people at every opportunity to make people aware about the mental health and mental illness that they can be treated. And many spirited individual members of the psychiatric family, they've taken it upon themselves to float NGO by making a lot of public advocacy and so on and so forth. Now the role of government basically is to provide a basic and very conducive environment for individuals to thrive and to maintain their mental well-being. So good road networks, good power supply, and so on and so forth. Food security is another important thing as part of maintenance of mental well-being. Then we need to drink plenty of water, abstinence from alcohol as much as possible, then no smoking. Smoking can be very dangerous.
NDLEA Zonal Commander, Lagos, talks about how open market purchase affects drugs and substance abuse.
Easy access to pharmaceutical opiates. Anyone who has traveled to
neighboring countries, the Francophone countries, Anglophone and Francophone in the sub-region would notice how difficult it is to buy pharmaceutical drugs without a doctor's prescription. But in our country, you can buy any drug, including dangerous drugs, because we have an open market system.
NAFDAC's acting DG takes people through her presentation on the challenges of tackling drug, substance abuse, and drug use in Nigeria.
For us within the regulatory space, the priorities are sometimes mixed up. And sometimes we have to look to where do you prioritize, and also the shortage of providers of help and care within this specific environment. Resource limitations and constraints have been mentioned here. Budgetary allocations towards health is still not optimal, and mental health, which is a subsector, is also disproportionately affected. As many of you know, it's an agency of government with the responsibility to regulate and control importation, exportation, manufacture, advertisement, distribution, sales, and use of narcotics and controlled substances, as we're limiting it as regards this presentation. Measures to ensure that the use of such products are limited to medical and scientific purposes only, as well as to grant the authorization for the importation and exportation of narcotic drugs, psychotropic substances, and general chemicals.
She highlights how prevention is the best form of tackling drug or substance abuse.
Facilities where we have approvals that have gone through the process, we have periodic audits of facilities, and for those who actually produce and we give permits for active pharmaceutical ingredients, we go to monitor and verify utilization. Now that's very key, especially when you talk about methamphetamines and the clandestine labs, because you see diversion happening with products that are going into the illicit drug supply. And so that's a very critical component to ensure that we have proper accountability within that chain. And because of that, we have a presence at the port where we collaborate with other agencies of government, and that has resulted in quite a few seizures of products within that space that have effect. Some of our major collaborators, as I've said, the National Drug Law Enforcement Agency, the UN Office of Drug and Crime, the Nigerian Customs Service, International Narcotics Control Board, who were very active, and of course, other players within the Federal Ministry of Health. So, it's easier to prevent than, of course, to go into the issue of rehabilitation. So if we can even prevent our young people, Dr. Oke spoke a lot about the youth subculture and the peer pressure that is attributed to that. If we can even get to a point where you prevent that first contact, then you now look to see to reduce the numbers.
That's all we have time for on the program this week. Make it a date for another insightful edition next week, same time, same station. In the meantime, if you have comments, complaints, or you want to report activities of fake drugs or adulterated food product peddlers, our doors are always open. You can reach NAFDAC via toll-free numbers. For inquiries, call 0700 162 3322. For complaints, call 0800 162 3322. You may also email NAFDAC at nafdac.gov.ng. If you have complaints about any form of misconduct, you can reach the Reforms Unit via email reforms@nafdac.gov.ng or call the Reforms hotlines on 0909 763 0506 or 0909 763 0507. NAFDAC, customer focused, agency minded. Importing, producing, distributing and selling fake drugs and cosmetics, adulterated food, and so on are criminal activities that destroy lives. Join the fight against these heinous crimes by reporting any suspicious activity in your area to NAFDAC. Let's join hands to safeguard the health of this nation. See you next week. Stay safe.